How to become a pediatrician. Pediatricians provide medical care for adults under 20 and children under 18, and also for some adults with pediatric illnesses. Working as a pediatrician can be a very rewarding career, but also requires a great deal of training, education, and both physical and emotional stamina. Read this article to learn how to get started. Getting your education and credentials. Obtain a high school diploma or pass the General Education Development GED test. This is the first step on the road to becoming a doctor. Classes like biology, physics, and chemistry will prepare you for the type of coursework you will be studying in medical school. How you perform in these types of courses will be a good indicator of whether medicine is the right field for you. If you dislike science courses like biology and chemistry, or find that you struggle to keep up with the classes, you might want to consider getting a private tutor to help you. If you are still having trouble even with the help of a tutor, then you should reconsider pursuing medicine and explore your other interests. Getting good grades in high school will be important when it comes to applying to a 4-year university. The grades you receive during your sophomore and junior years are important. Be sure to complete assignments on time, study for tests and quizzes, and keep up with reading assignments. Graduate from a 4-year university. You should apply to several different universities and choose the most prestigious one, as this will increase your chances of getting into medical school. Most students who pursue medicine choose pre-med majors like biology or chemistry, but you don't necessarily have to graduate with a Bachelor of Sciences BS.NC3. Greater than students who graduate in social sciences and humanities can also be accepted to medical school. Even if you don't graduate in sciences, you may need to complete certain requirements in chemistry, physics, general biology, and calculus. The specific requirements will vary between schools, so check around with the various medical schools you plan on applying to. Increase your chances of being accepted to a top medical school by volunteering or working in an environment that deals with public health. Volunteer at a hospital or nursing home, or find a job working in a pharmacy. Take the Medical College Admission Test MCAT. The MCAT is a standardized multiple-choice test that is required for admission to medical school. The topics covered in the test include physical sciences, biological sciences, and verbal reasoning. Prepare for the test by buying an official MCAT handbook, taking practice tests, hiring a private tutor, and/or taking an MCAT preparatory class. Prepare for the test by buying an official MCAT handbook, taking practice tests, hiring a private tutor, and/or taking an MCAT preparatory class. Finish medical school. Most medical school programs are 4 years long. During the first 2 years, you will study broader subjects like physiology, chemistry, human anatomy, and pharmacology. During your second 2 years, you will narrow down your focus to a specialized field, including family practice, internal medicine, and pediatrics. Greater than annual fees for medical school average at $25,000 for state residents and $48,000 for non-residents. Consider getting a loan, grant, or scholarship to help you pay for medical school. Complete a residency at a hospital. Once you have graduated from medical school, you will need to complete a 3-year pediatric training program at a hospital before you can start your own practice. During this time, you will be given hands-on training and develop your skills in treating and dealing with sick patients. Over the course of the 3 years, you will be given an increasing amount of responsibilities and learn how to properly interact with patients. The training program must be accredited by the Accreditation Council for Graduate Medical Education ACGME or the American Osteopathic Association AOA. Residencies are the most challenging part of becoming a doctor. You will be working very long hours, 80 to 100 hours per week, and will be paid a minimum wage. Expect to devote all of your time to completing your residency. You will have very little time to spend with friends and family. Get board certified. You will need to receive and maintain a certification to practice pediatric medicine by the American Board of Pediatrics ABP or the American Osteopathic Board of Pediatrics AOBP. There is a limit of 7 years that can pass between the time you finish your pediatric training and become board certified. Certifications expire on December 31st of the specified year of expiration, and doctors will have to renew their certifications to continue practicing.